there's so many questions online here. One of the fun things about having this virtual conference as well is that not only are questions coming in, we're getting a lot of answers to your board questions as well. So I would encourage the folks who are on the board to capture this transcript and read this as well. This question is from Julie King. Where, and is consistent with some of the dialogue we've had, where is the best place to get standards that already exist for nursing regarding collecting quality measures to prove outcomes for effectiveness of care?
Where is the best? This is Rosemary Kennedy. Where is the best place to get standards?
It sounds like we have somebody who's interested in consuming standards to improve outcomes.
Okay, and there are multiple levels of standards in improving outcomes. From a quality perspective, not so much the terminology and information standards, because we are currently aligning them with the quality standards, but certainly the nursing national database of quality outcome indicators, and many facilities are using their electronic health record to report outcomes and send that is one area, and using the National Quality Forum endorsed measures, nursing sensitive measures, and all of the other measures certainly can capture, and it's a great place to start to use the electronic health record. As we stated before, as an industry, we're looking at some of these standards to enable them and to extend them for purposes of quality reporting, but certainly there are things there to get started with, and as we continue working with the standards organization, we will extend them in ways that are necessary. So we get our guideline developers, and many nurses are working for knowledge vendors, structuring that information. Then it goes down to the actual measure, and you need to structure that using consistent terminology. Then get that into the electronic health record and use the interoperable standards. So much work underway, much effort towards that direction, and I think great promise for achievable things.
Thank you so much, Rosemary. This is Linda Fischetti. So one anonymous response to one of the folks who was writing online, they're asking for a very specific application that can meet a very specific need, and I would encourage them to post that same question out on the Caring listserv, and that's a wonderful community resource for them, and they will get lots of opinions, not from the vendors, but from the people who actually are installing and using systems. We also want to let folks know we've had questions about when this transcript would be available, and the slides are available online right now, and the transcript and the video recording will be posted by close of business tomorrow. And then finally, I just would like to thank my colleagues for coming and participating and giving of your very busy schedules to help inform the NEHC board as we move forward with our agenda for what we will be working on and where we will focus our energies for the years to come. So thank you very much.
Yes, thank you so much. And this is John Tooker, and our apologies to those online who asked questions and that we didn't have time to respond. There is a good reason. We had about 230 registrants for our webinar, and we were having as many as 125 on it at a time. So a very robust response to one of our most exciting activities at NEHC, our stakeholder forums. In addition to the webinar questions, there has been a Twitter feed going on throughout this, and we really want to thank Sherry Reynolds for her leadership in driving the Twitter feed. Sherry was involved, very much involved in the governance work group for the original development of the National eHealth Collaborative, and has been a great supporter ever since that time. This will close and conclude today's stakeholder forums. Before we move into the public comment portion of our agenda, I want to let everybody know that during the executive session we'll be holding shortly, we will be having more discussions about the future activities of the National eHealth Collaborative, including our educational programs. We'll also be focusing on coming up on a year of activity of the National eHealth Collaborative, and we'll be talking about our annual elections for both board members and officers now. it's very fitting, Joyce, that we're going to be talking about that a year later after our conversation about the nursing presence within the National eHealth Collaborative. And we will also hear from our Finance and Audit Committee. I would be remiss, though, if I didn't mention one person in our audience, and that is Dr. Rob Kolodner, who we're very pleased to have with us today. And Rob played a huge leadership role in developing the National eHealth Collaborative. And Rob, we're very pleased to see you today. Thank you. And at this point now, we're going to turn to the public comments. If anybody in our audience attending today would like to come to the microphone and make a comment, we'd be pleased to have you do so at this time. If you are participating electronically and would like to make a verbal comment, you must be logged into our webinar and have used a webinar-generated attendee ID, I'll never get away from that, attendee ID when you dialed in over the phone. This combination is the only way that we can identify you so that your phone line can be unmuted. To let us know that you would like to be called upon, please click on the raise hand button that appears just under the list of today's online participants. Or you can send us a comment online and we'll read aloud at the end of the comment period now. Would anybody like to come to the microphone and ask any questions? We know who you are. We can call on you if you'd like. Seeing none, and Merit, to our knowledge, we aren't having any comments or questions coming in. Seeing none, then this will conclude the public portion of the October NEHC meeting. We're very pleased to have you in attendance, and I want to personally thank all of those who participated today, both online and in person. And a huge thanks to our two panels and to the organizers of those panels, namely Merit, and I will be introducing the staff in just a minute, and to Steve Ruberg and to Linda Fischetti for leading and coordinating these panels. Before we close, I do want to recognize our staff, our Interim Executive Director, Brian Heckert, Ernest Clover, Alex Baker, and Merritt McGinley. And they've done just a huge amount of work in between our meetings and preparing our meeting. And with that, absent any other comments or questions, the public session is adjourned. Thank you.